I'm going to introduce Raj Cuddy, who's going to talk about iVEDiX and take it from there. Thank you.
Thanks, Scott. Appreciate it. As Scott mentioned, I've spent about 20 years in big data and analytics. 4 of those years were spent with a small team, hunkered down, trying to engineer and design a product that right off the back would curate an incredibly phenomenal experience. And here's the key word, experience of interacting with data. Our first version of miVEDiX, which was a product that we launched, could not only connect to any data source, whether that's assets, traditional data sources, or social media, in real time over a mobile device, and you could get access to any part of that content personalized within an average of 2 touches. Since we launched over 18 months, we've gone through multiple capabilities, including being profile aware. So if you're a physician or a nutritionist or a dietitian or an administrator, you could get your view of the content personalized as soon as you log in. You don't have to create anything. You don't have to do anything. It's there for you. Okay. Since we launched, we've also been vetted by multiple external agencies, including former NSA agents in terms of penetration testing. We are completely HIPAA compliant and more. And we are scalable. More on the scalable part later. But one other important aspect as we roll it out to practitioners is that we can read and write back to sources. I want to talk a little bit about the trends. In 2007, there's this little thing called the iPhone that was launched. Nobody needed it. Everybody wanted it. Right? Since then, we may not know, but we have this subtle notion of experience that we always stick with as we use our mobile devices. When we go home, we're glued to it. When we come to work, we go back to our desktop, and we expect that to be the norm. We wanted to change that paradigm. There's a couple of different worlds that are converging. Let me give you one big fact. 15 billion, what is that? As of this year, we will have as many mobile devices as there are people on this planet. Just to give you an example, Apple sold 30,000 devices in 1 hour last year. Okay, so it's coming. You've got less than 5 years before it hits 15 billion. Okay, so what are we talking about in terms of convergence? Visualization and experience are coming together. You have to manage everything, so therefore you measure everything. So that's coming together. So analytics is becoming front and center. So everybody's talking big data. People are yet to figure out small data. That's just a reality. And so when you merge the devices and you merge analytics and you're merging visualization and all of these things coming together, you are now generating more data than you could comprehend. What that's bringing to us is that the production versus the utilization, there's a huge gap. And that's what we want to address, not just in terms of data, but also in terms of transforming that data into visualization and creating and curating a beautiful experience for the end user. Because if you can't engage the end user, then you've lost the game right off the gate. Okay. Healthcare is no different than any other vertical. Information access is incredibly painful. I think most of you know that firsthand. There's a ton of clinician frustration because there's information, but you've got to log in 17 times or go through 54 clicks before you can actually get to that piece of information. And then as a consequence, as a direct consequence, there's no shortage of applications for certain functions. But if you can't use them and the providers are not engaged, then how are you going to engage the patients? And that is a big disconnect. There's lots of ads talking about the disconnect between the physician, the provider, and the patient. And that is a big problem in healthcare. Just to give you another example, 80% of the content that people are going to expect in the next 4 years is going to be through native mobile apps. It's very simple. Since we launched 24 months ago, we've done over 100 pilots. Might be closer to 130. We've translated a lot of them into contracts and paying customers. We started off with about 100 users right off the gates. And since then, as of the end of last year, we have increased our user base to over 10,000. 70% of that are in the healthcare profile. Speaking of providers, I want to give you a care provider's perspective. They came to us with some frustrations that we have been hearing time and time again as we travel through the country and talk to the providers. We are losing referrals. We're also having a big problem keeping the physicians happy. They're frustrated with their devices. They're frustrated with disengaging with their patients. They're having to tether their laptop. As cool as that was 15 years ago, it's a burden today. They wanted to change it for two reasons. One is they wanted to recruit and they wanted to retain their physician community, because the next generation of physicians, guarantee you, they're not going to be talking about laptops. As of this week, they rolled out through the App Store access to 5,000 physicians. Let me give you some core metrics. It was the most widely used adopted application that they've ever rolled out. It was also had the highest usability index. Their average application index, usability index, was 64. When the application was rolled out, it was 98. So engagement was important. Ultimately, what is their objective? If you've got great experience, you've got great engagement. If you've got great engagement, you've got great quality. You know where I'm going with this. Great quality, great value, and value results in reimbursement. So there is a holistic objective. So engaging more of the physicians through a great application was significantly important, an important part of their strategy. We're also actually handling other use cases outside clinical rounding. We've got care coordination, patient throughput, workforce optimization, public health, and clinical decision support, as Scott mentioned. So analytics comes right off the gate. We've got a great analytics engine as part of the tool set. Tons of benefits. That's an actual picture of a go-live situation where we did workforce optimization. We were doing a scheduling application dashboard real time. Why does this all matter? We're all here for a common purpose. We all want change. We all had moments of truth in our life that forced us to say we're going to do something different. The accelerator has been a great program validation from our standpoint. We come at it from a technology perspective. You have a much better perspective in terms of an industry. So us coming together, we actually have the ability for the first time in history to be able to leapfrog from where we are to where we want to be. All right. Thank you very much.